Now, where we're going to speak now about the specific fractures of the bodies. So, to know the clinical presentation of fractures, you need to know the specific fractures of the body. Is it clear? Now, you need to know that what we can have fracture of the maxillofacial region, and those are maxillofacial fractures. Is it clear? Generally, with maxillofacial fractures, you're going to use the Lefort classification for maxillofacial fractures. When you have maxillofacial fracture, you use Lefort classification. I'm going to send you the link. I'm going to show you the images for each of these classification. Now we can have also basal skull fracture that can be seen at the level of the cranial folds. Is it clear? We have also the cranial, yeah, that can be seen in the basal part of the cranial fossa. Is it clear? Now, other fracture that you can have the spine fracture. Is it clear? You can have the hyoid fracture. Is it clear? The hyoid fracture can be involved in the case of a hangman fracture. You have a hangman fracture both on the hyoid and the spine fracture. Is it clear? You have spine fracture. Is it clear? Spine fracture. Spine fracture is associated now with which classification? The Dennis classification. Is it clear? And now you need to know that generally the presentation of fractures is that you are going to have signs of inflammation of that region. One, you are going to have reduced movement of that limb to all the movement. That is different from a muscle injury. When you have a muscle injury, you just have a reduced movement in the action side of the muscle. But when you have a fracture or you have a dislocation, the movement is reduced on all the sides. Is it clear? The next thing is that you can feel crepitations. Is it clear? It means that you can crepitate the two part of the bones, and there is a gross deformity of the limb. Gross deformity of the limb when you have a fracture. Is it clear? Another element is that you're going to have a limb length discrepancy, a shortening of the limb when you have a fracture. That's why it's always important to know anatomic landmarks, particularly in the lower limb. You have to measure the apparent length and the real length. In order for you to know all these measurements, you have to go to the SchrDbb TikTok channel, which is involved with surgery. You're going to understand all those. Now, after visualizing the spine fracture, which is the Dennis classification, you have the upper limb fracture. When you have a humeral fracture, we use what is called the Niers classification. With humeral fracture. When you have a radial fracture and ulnar fracture, we are going to have what is the Monteggia. You're going to have the Monteggia fracture, and you have also the Galeazzi fracture. Is it clear? The Monteggia fracture, the Galeazzi fracture. Is it clear? Now, I've forgotten that with the humeral fracture, we have an injury also called the Holstein injury. Is it clear? The Holstein injury is when you have a fracture of the diaphysis of the humerus, and then you have a radial nerve palsy. Is it clear? If that's called a Holstein injury. A Holstein injury is when you have a fracture of the humerus, the humeral shaft, and you have a radial nerve injury. Now, a Monteggia fracture. Is it clear? What's a Monteggia fracture? A Monteggia fracture is a fracture of the ulna with a proximal radioulnar dislocation. Is it clear? A Galeazzi fracture. What is a Galeazzi fracture? It's a fracture of a radius with a distal radioulnar dislocation. It is different. When you have a proximal radioulnar dislocation, you are not capable of both doing supination and pronation, and also you're not capable of doing flexion and extension movements. But when you have a distal radioulnar dislocation, you are capable of doing flexion extension, but you're not only capable of doing supination and pronation. That's the different ways that you have to understand. Still with the radius and ulnar, you have the nightstick fracture, which is an isolated ulnar fracture, and you have a bilateral ulnar and radius fracture. The next one you can have also is scaphoid fracture, and you have also lunate fracture. Scaphoid fracture, it is the one which can also be associated with the avascular necrosis of the scaphoid head. Is it clear? Just like the femoral joint, the femoral head, when you have a femoral neck fracture, the scaphoid fracture also have an avascular necrosis of the scapular head. Is it clear? Because those are the two major parts in the body that has retrograde circulation. Is it clear? Those are the elements that you have to know. The next part after the avascular necrosis of the scapular head, we have also the lunate fracture. Lunate fracture is specifically not seen on the X-ray, is it clear? But if it is not managed appropriately, somebody can end up with a Kienbock disease, and a Kienbock disease is pain at a chronic wrist pain on movement, is it clear? Particularly flexion and extension movement, is it clear? You are going to have Kienbock disease associated with a chronic wrist pain when you have not managed properly a lunate fracture. Is it clear? Now, the next part after that, we are going to have also fracture of the head of the metacarpal, of the feet metacarpal. When you have fracture of the head of the feet metacarpal, it's called the boxer fracture. Is it clear? Fracture of the head of the feet metacarpal is called the boxer fracture. Now, when you have fracture of the base, fracture of the base of the first metacarpal, fracture of the base of the first metacarpal, it is called the Rolando fracture, the Rolando fracture. Is it clear? So when you have fracture of the base of the first metacarpal, it is called the Rolando fracture. Now the next one is if you have now the fracture of the distal radius. Fracture of distal radius is very important. Is it clear? Because the distal radius is the part where you are going to have the passage of the carpal tunnel, and there's a major nerve that passes inside the carpal tunnel called the median nerve. Is it clear? So when there is a fracture of the distal radius with posterior displacement is going to be called a Colles fracture. Is it clear? Colles fracture is going to be less severe. Is it clear? Because it does not compress the carpal tunnel that is located anteriorly. So when you have a fracture of the distal radius and a posterior dislocation, it's called a Colles fracture. And the shape of the arm in that case, of the hand in that case, is a Dinah fork deformity. It's going to have a Dinah fork deformity. Now, if you have a fracture with an anterior dislocation, is it clear, of the distal fragment, you are going to have a deformity called a garden spade deformity. Garden spade deformity. And that garden spade deformity is particularly seen in Smith's fracture. And this is poor prognosis. Why? Because there is compression of the median nerve. So it's an emergency surgery. Why? Because the median nerve can get compressed, and then the patient has later on a median nerve palsy. So those are the different elements that you have to understand for the upper limb. Now, for the lower limb, you can have dislocations and you can also have fractures. Basically, I did not speak about, in this tutorial, we did not speak about dislocation. We are just based on fractures. But for the lower limb, you have a posterior hip dislocation. When you have posterior hip dislocation, we use the Thomson Epstein classification. When you have a posterior hip dislocation. When you have a femoral head fracture, we use what is called the Pipkin classification. When you have the femoral neck fracture, we use what is called the Gardner's classification. When you have a trochanteric fracture, intertrochanteric fracture, you use what is called the Donan's classification and somebody else. When you have a femoral plate fracture, when you have a tibial plate fracture, we use what is called the Schatz-Kerr classification. I'm going to send you all these classification at the level of the comments, so just remember me. When you are going to have when you have a floating knee is one that there is a fracture on the epicondyle of the femur, and then this fracture of the femoral plate. Is it clear? That's called a floating knee. And the floating knee the classification for floating knee, we use what is called the Fraser classification. We use the Fraser classification for floating knee, either with an S or a Z. Fraser classification. When you have fracture of the ankle, is it clear? When you have fracture at the level of the ankle involving the syndesmosis, compare it with the syndesmosis, we use what is called the Weber classification. Is it clear? So those are the different classifications, specific classification that you're going to use in order for you to know the prognosis and the method of management, best management that suits the patient based on this classification. Basically, now after visualizing that, the next thing you're going to see are going to be you're going to see now the complications of fractures.